We have a very serious challenge ahead of us to rebuild general practice and to strengthen Medicare, and that's why those policies were right at the centre of our election policy at the last election. Just later this week, I'll be having my third meeting with the Strengthening Medicare Task Force. I chair that task force, including the head of the AMA, the head of the College of General Practitioners, the Rural College, patient groups, nursing groups and others. We'll be reporting by the end of the year to government with recommendations about how best to use the $750 million commitment we made that will be rolled out from the budget next year. But I do want to make it very clear, I'm deeply concerned about the state of general practice. It is not going to be easy to turn around a statistic like only 15% of young medical graduates choosing general practice as their career. I am under no misapprehension as to the scale of that challenge, and I see that as the highest priority in health policy for this government.
Them to stay in their jobs? I mean, if GPs are leaving after they've already chosen that as their profession, what's the incentive to get them to stay?
Well, this is the work of the Strengthening Medicare Task Force, and I don't want to preempt the advice that will come, as I say, from the head of the AMA, the head of both colleges, the Royal College and the Rural College, as well as patient groups and nursing groups, about the best way to rebuild general practice. But they're very clear that the priority for that group is to turn around general practice after 9 years of cuts and neglect. And look, there's no question that those pressures that pre-existed COVID, that flowed from the treatment of Medicare rebate by the former government, have been substantially aggravated by the additional pressures placed on GPs and their staff and practice nurses and allied health professionals by the pressures of the pandemic. There's no question about that. But equally, we can't think that as the pandemic recedes, which we all hope it will over coming months and years, that things are going to return to normal in general practice. Those pressures are more significant than just the pressures of the pandemic.
When can parents expect a Pfizer booster to become available for children aged 5 to 11?
Well, look, I'll have more to say about that when I get some final advice about it.
Just an aged care question, Minister. The Commonwealth submission to the Fair Work Commission case says that the government will support a wage increase, but the extent of this is a decision yet to be made by the government. Can I just ask, will the Albanese government fully fund the any wage increase, and will this be factored into the October budget?
Well, we've made very clear from the time of the election campaign, Anna, that we're very clear that it's a Commonwealth responsibility to fund aged care, particularly the care costs associated with aged care. Obviously, families make a contribution to the accommodation costs of aged care. Aged care residents pay about 85% of their pension for food and laundry and electricity and such like. But it is a community responsibility to care for older people who require aged care. And so the flow on to care costs of the aged care wage campaign, the Prime Minister and a number of the rest of us have made clear, is recognised as a Commonwealth responsibility. The case is still under consideration by the Fair Work Commission. There's no indication yet as to the timing of the decision that will be delivered by the Fair Work Commission, but we'll respond to that in due course.
Minister, your shadow counterpart, Anne Ruston, this morning raised some concerns about the abolition of the cashless debit card. The coalition members have talked about potential issues around drug and alcohol abuse in those communities once the card leaves. I know it's not strictly in your portfolio, but are you satisfied that the extra funding that Minister Rishworth has announced in drug and alcohol services, other social supports, will be adequate to address those problems in those communities?
Well, Minister Rishworth is working very hard, and she's consulting closely with communities. She's travelled extensively through impacted communities on the delivery of our commitment to abolish the cashless debit card, a card that was recognised by the Audit Office as ineffective as against its stated aims by the former government. Obviously, she is working very closely with a range of her ministerial colleagues, and that includes my portfolio in health, to ensure that proper support services that are traditionally funded by the health portfolio are in place, as they should be for those communities. But I think it's important that I allow Minister Rishworth to talk about that.